Okay, I think that Sister Margaret, Sister Sarima will get started. You can all see the screen there. We have pressed record on this session. Thank you everyone for joining. This is the 13th webinar in the COVID-19 webinar series. Many of you, we're so grateful for the support for the series, the interest that you're showing, and for many who are attending, have attended more than one session. As with previous sessions, I'm asking, especially those that are new to the series, to put their email and name in the comment section, because we're gathering emails so that we can include you all in future communications. So this week we have two webinars running. We have one this evening, the topic of environmental cleaning and disinfection in the context of COVID-19. Our presenters are Sister Sarima Vatuvatu, IPC Pillar Chair, and Sister Margaret Leong, IPC Pillar Member. So grateful to them for their time in preparing this presentation for you all. And as mentioned, we have recorded the session. We hope to add the webinar recording to the Ministry of website. You'll find on the Ministry website, there's about 7 other recordings from previous webinars. So please feel free to go and take a look. For this particular SOP, it has been, it's an endorsed, naturally, it's an endorsed SOP, and it is also on the Ministry of website under the COVID, within the COVID section, and that the SOP itself and the auditing tool that our presenters will talk to. So without further ado, I'm going to hand over to Sister Sarima. Thanks very much.
Watching another webinar session this evening. So like what Liz has mentioned, we'll be talking on the environmental cleaning and disinfection in the context of COVID-19. So this is another SOP that the IPC cell was tasked to review. And what we're going to be discussing about this evening is on the second version of the SOP. So as part of the introduction, the next slide, Liz, if we can go through the second slide. So we were talking about environmental cleaning and disinfection in the context of COVID-19. You know, there's been studies that's been done around environmental cleanliness, around disinfection. Thanks, Liz. That's the slide that I was waiting for. Yeah. So like what I was saying before, the IPC IMT cell was tasked to review this, and this is the second version of the SOP. We acknowledge the team that had developed the first edition of this SOP. And we know that with studies on cleaning and disinfection, we learn new things about the virus. So this is why we will see that our SOP will continuously be updated. I think somebody's mic is on. So I've been exploring or looking through some studies around cleaning and disinfection. So, and when we talk about the SARS-CoV-2 virus, or even its genetic material, the RNA, it's been detected on surfaces in a number of studies that has been conducted, especially in healthcare settings and also in the community. So it is generally reported in these researches that the environment is most contaminated where a patient is accommodated in, or that's near an infected individual, and also on the surfaces that they frequently touch. So this is why we have this SOP on cleaning and disinfection. Although we look at the prevention and control measures of COVID or of the epidemic, okay? So we see that it's generally recommended in the pandemic context that we minimize contacts or we avoid overcrowding. we practice our physical distancing. We must adhere to our hand hygiene and also the use of respiratory etiquettes and mask wearing. These are considered essentials for reducing the risk of contracting SARS-CoV-2 virus. However, we should not underestimate cleaning and disinfection. This is also important, as studies have shown, that will facilitate limiting infections, cross-contaminations, or even limiting clutter and removing non-essential objects that shouldn't be in our homes, probably in your office settings, if we have non-clinicians listening, and also in our healthcare settings, especially when we look at our quarantine and our isolation facilities. So I'm going to hand over now to Margaret, and she'll guide us through the SOP, and I will take us through the checklist that's also available that can guide each one of us to ensure that we adhere to the SOP that we're going to discuss this evening. Thank you, Margaret. Over to you.
Thank you, Sarema. Can I have the next slide, please, Liz? Thank you. So just continuing on from Sarema's introduction, and again, this presentation has been extracted from the Fiji SOP. So nothing is being presented that's not in the guideline. So just continuing on from where Sarema left off. Now, depending on the environment and the type of surface, the virus that causes the COVID-19 virus can be found for long periods, as you know, and you would have read, ranging from hours to days. And we know that, you know, the virus can survive up to 28 days in one of the studies. So in the healthcare settings, the virus is more concentrated. So there's a increased load of the virus. And so the environmental surfaces in the healthcare settings or in isolation rooms are more likely to be contaminated with COVID-19 virus, mainly because of you know, the mode of transmission of the virus, and you know, and the way it's transmitted through through contact and through respiratory droplets. So so especially in healthcare settings where we do a lot of medical procedures that are performed, can increase the viral load on environmental surfaces. And these environmental surfaces are really where we have COVID-19 patients or confirmed patients that are being cared for. So you know, it makes a lot of sense that the environmental surfaces, and because of the evidence of you know, of the virus surviving on environmental surfaces and the potential for my transmission, it makes a lot of sense, you know, for environmental cleaning to be done at least twice a day to prevent further transmission. And the further transmission would be through indirect contact, you know, through touching the environmental surfaces with contaminated hands, and then you know, touching your eyes or your mouth or your nose. So you know, this advice is also applicable to other settings for patients with COVID-19, and especially now that we have a lot of COVID-19 patients being, you know, being nursed at home, you know, being isolated in their own homes. This information is very much relevant to them as well, and not only to healthcare settings, but it also includes quarantine centers and households where we have COVID-19 positive patients. So moving on to the next slide. So this is the introduction of that's in the SOP, and so 2.0 of the SOP highlights the purpose of the SOP. So the main purpose of the SOP is really to provide you guidance on the cleaning and disinfection for environmental surfaces in the context of COVID-19. So wherever patients are admitted, this SOP applies to that context, in that context. And also it's to provide you with some guidance around techniques for using cleaning cloths and mops. And also is to provide some guidance around monitoring and evaluation. And in that regard, we've also developed an audit tool that you can easily use or adapt to your setting. Next slide. So just going over some knowledge and definitions that the template follows with all SOPs. So as you all know, and as I learned as well, environmental cleaning is not as straightforward as we think it is. And I'm sure that you would all agree with me that it can become quite a complex process, because really what we're trying to do is reduce the load of the virus and trying to eliminate the virus from the environmental surfaces. And it makes it more difficult because we cannot see the virus with our eyes. So, there's stages in cleaning when it comes to the context of cleaning for any infectious agent that we are dealing with. And this is not your normal cleaning. So in your normal environmental cleaning, you don't really need to use these steps that we are going to go through. However, in the context of a transmission-based precaution, infectious agent, we have to follow these steps. So definitions are very important. So cleaning is includes first and foremost, cleaning with soap and water to really, and what it really does is it removes removes almost all of the pathogens or all of the COVID virus from the surface, but it does not remove all. So cleaning basically reduces the load of the COVID virus on the environmental surface, but it does not remove all. So that's why disinfection comes in. And what disinfection does is that it uses a chemical, and the chemical will kill almost all of the COVID virus on the environmental surface. So that's the basic principle for cleaning, that prior to disinfection you must clean, because cleaning will remove the majority or of the virus on the surface, and then the disinfection will work on that surface that has been cleaned by killing the germs or the COVID virus that's left over from cleaning. And as you all know, sterilization is another level. It's a decontamination, another level of sterilization, which doesn't apply here in this context, but it's there. It's just been put here for your information, because with disinfection, it involves intermediate level of cleaning of disinfection, and then sterilization is total removal, total eradication of viruses and bacteria. So it's a process that destroys all or removes all all microbial contamination to render a surface clean. So next slide. So that was just to give you some definitions that make up the environmental cleaning definition in the SOP. Section 3.0 in the SOP in regards to processes highlights the importance of training in the context of COVID-19. So educating our cleaning staff on how cleaning must be done is very, very important. And also it is a responsibility for all of us, every one of us, all healthcare workers, doctors, nurses, lab technicians. So everyone needs to know the correct procedures involved in environmental cleaning and disinfection in the context of COVID-19. And even though you don't clean, you may not be responsible for cleaning. It's important for you to know so that you can ensure that the procedures that are put in place are followed consistently and correctly. It's important that everyone is aware of it. So training, including how to put on PPE, is important for our cleaners. So in terms of PPE requirements for our cleaning staff, they also need to wear full PPE when cleaning the environmental, performing any form of environmental cleaning. So it's mandatory for all of our cleaners to attend some basic IPC measures, going through hand hygiene, going through some of the elements of standard precautions and so forth. It is also important, and the SOP highlights the importance of having posters that should be around the area for the cleaners to be reminded, for example, of hand hygiene, of PPE, of waste, of proper disposal of waste. So it's also important that part of the training that the staff must be competent in, the cleaning staff must be competent in the cleaning procedures. And I think it's important that they are competent because when you do carry out your audits using the environmental cleaning tool, audit tool, you will be auditing them around how they wipe down a surface, a frequently touched surface. How are they mopping? How are they preparing the disinfection solution? Is it the right is it right? Are they using the correct measures and so forth? So these measures are very important to ensure that all of our cleaning staff are following the proper measures for cleaning. So next slide. So under section 3.2, this two-step cleaning procedure is recommended. So this is part of the SOP that in the context of COVID-19 isolation rooms, that the room has to be cleaned first with a normal detergent and water, allowed to dry before a second clean is carried out with a 0.1% bleach. And I have a slide, and also in the SOP, there is instructions on how to prepare a 0.1% bleach using a very simple formula. And so the same steps in the two-step clean it should be applied to cleaning floors and wiping surfaces or frequently touched surfaces. And so I've put a point here that, avoid using spray bottles because, you can accidentally get the bleach into your eyes with the sprays. But we do recommend the use of squeeze bottles because it's much safer to use with squeeze bottles as opposed to using spray bottles. Next slide. So just some key messages so far on what I've addressed is we're going to touch the importance of frequently touched surfaces. There are areas that are mostly contaminated with COVID-19. We also highlighted that cleaning and disinfecting is important in terms of ensuring that it's done not only once, but at least more frequently, at least twice. And also I wish to highlight here also in the SOP the importance of having ensuring that you have adequate supplies for waste management and the waste is being stored appropriately. and you have access to water. This is the wash component of hand hygiene. So access to water and sanitation are also important components to consider or to ensure that you have. Next slide. So in regards to frequently touched surfaces, this is very, very important that we all are aware of frequently touched surfaces in the context of COVID-19, because we know that environmental surfaces become contaminated from respiratory droplets, and also fomite transmission can occur through indirect contact. So these are the frequently touched surfaces in the context of COVID-19. So the first picture is sort of more in the context of an ICU setting, whereby you have ventilators. So remembering, the keyboards, the screens, the infusion pumps, the armchair railing of the armchairs, and so forth. So every space that that is frequently touched are considered a frequently touched surface, and that has the potential to be transmitted to someone. The risk of fomite transmission is very high, and not only in this context, but in the context of during transfers of patients. So when you're transferring a patient also, this is also important. So not forgetting, the switches, the light switches, and this is also very important for our households that have COVID-19 patients. So we should be talking to our so we should also be talking to our patients about this area, the frequently touched surfaces, and not forgetting the door handles as well. Next slide. So I think there's some people talking. Can you please mute?
Sorry, Margaret, we just muted them. Can you unmute yourself again, please?
Okay, thank you, Alipate. Okay, so in terms of cleaning cloths and how do you clean, this is very important, and this is one section that we had up, and this is in section 4.0 of the SOP, and this is one section that wasn't in the previous version of the SOP. So use of cleaning cloths, again, we recommend that you use disposable cleaning cloths if you possibly can do that, especially in the context of COVID-19, or use this sort of rolls that are very cheap in the supermarkets. So the way to use cleaning cloths is to fold them into four or 8 sides. I usually do the 4 instead of the 8, and you wipe each surface with each side of the cloth, and you keep turning the surface of your cloth around until you use up all the surface. So once you wipe all the surface, then that cloth is then put into a separate container, and you are to use, so you don't rinse this cloth out and reuse it. You are supposed to use a fresh cloth in the context of COVID-19. And I'm talking here about your frequently touched surfaces. Now, all the surfaces that we discussed in the previous slide, very important that you don't rinse out your cloth and use it again, but you use a separate cloth. And the reason for that is because you need to clean and disinfect that cloth if you're reusing cloths before you actually can use it again. So it's important to have quite a few cloths ready for this purpose. And if it's not possible, then you've got to clean and disinfect your cloth before you reuse it. So that's the technique in cleaning or in using cleaning cloths. So can I have the next slide? And after you wipe the surface, then you will use the sodium hypochlorite 0.1% to wipe wipe these surfaces in the same manner. So when you're wiping large surfaces, you wipe in an S shaped pattern, and I know that you can visualize this. Do not go back on that S shape, but you keep moving forward, and you always move from the cleaner parts of the area that you are cleaning to the dirtier part, and always ensure that the area or the surface is all clean. So remember, the key here is that you clean first with the detergent and water, and then you do another clean with sodium hypochlorite 0.1%. Next slide. So the next slide is in regards to mopping, and this is on the SOP. It's on 4.2 of the SOP on mopping and how to mop. We recommend in the SOP using a 3-bucket system, but if you don't have three buckets, you can use 2 buckets. The main principle here is that 1 bucket should be your rinsing bucket, should be your plain water. So the first bucket will be your detergent and water. And if you only have 2 buckets, let's say you only have 2 buckets, your first bucket is your detergent and water, and your second bucket is your clean water. And so the clean water, the plain water, and that bucket is to be used for rinsing your mop, squeezing it before you put it back into the bucket with the detergent and water. So next slide. So the steps in mopping, and again we have put this in the audit tool. So when you are audited, you will be audited against the steps in mopping. So again, as I had stated earlier, that you put your mop in the first bucket that has the detergent and water, and you mop portions of the floor using an overlapping strokes, and then turning your mop regularly, and then you need to put it in the rinsing bucket. So with a bucket with the plain water, rinse it out, squeeze it out, and then you put it back into your detergent and water, and you wipe out that whole surface, you mop out that surface until it's done, and you keep changing your rinsing bucket. So the bucket that has the plain water needs to be changed often. So you can't use that 1 bucket for the whole area you're mopping. You have to change the water maybe 3 or 4 times in order to do a proper cleaning. And this is the real way to do mopping, whether it's COVID or not. These are the correct steps for mopping, especially in healthcare settings. And then once the floor is dry, you have to wait for the floor to be dried before you follow with a mop, the second mopping with a disinfectant. That is your 0.1% sodium hypochlorite. Now, I wish to stress here, and it's in the SOP, that that sodium hypochlorite, the concentration I think it's the next slide. If we move on to the next slide, sorry, I'm moving ahead of my slides. So in terms of the disinfectants, the one that we recommend, that very simple, not very simple, but very cost effective, especially in outside of the central division. Even in households, we encourage, it's cheap. Sodium hypochlorite is your household bleach. It's cheap, and it doesn't cost much money. And this is sort of the advice we give to our household COVID-19 positive patients. So it's the concentration for sodium hypochlorite disinfection is around 0.1 to 0.5%. But 0.5% is more stronger, and this should be used ideally for blood spills or body fluids on the large spills of blood and body fluids on the floor. I wouldn't, the recommendation is to use 0.5% instead of 0.1%. And, WHO recommends 1 minute for contact time on their guidance. But, I would recommend that you leave it for as long as possible. More than 1 minute is sufficient. And we've got in the SOP 10 minutes. So for small surfaces in the isolation room, you can use alcohol, 70%. So alcohol is also preferred for metallic surfaces because sodium hypochlorite can corrode metallic surfaces. So we recommend for small surface areas that you need to clean. But remembering that you need to clean first with detergent before you use alcohol, 70%. Yep, next slide. So the next slide is in regards to terminal cleaning. So this is when your patient gets discharged or your patient may go home. You need to do terminal cleaning of the area. And so terminal cleaning just means, I think you've gone out of slide mode. Thank you. So terminal cleaning just means that you're doing, cleaning and disinfection after the patient has been discharged. And the aim here is to remove all of the COVID virus around the environmental surfaces. So you need to do cleaning of, higher areas, also bathrooms and toilets, and, all of the surfaces need to be cleaned. And the whole gist of the terminal cleaning is to ensure that there is no potential risk to transfer the virus to the next patient. Next slide. So this is still on terminal cleaning, and this just to remind that in terminal cleaning, curtains need to be changed if possible and cleaned. So the whole mattress pillows need to be wiped down with sodium hypochlorite as well. And the bathroom floors, toilet floors, and everything needs to be cleaned, all the frequently touched areas and so forth. And Sarema will be taking you through the checklist that we've developed for terminal cleaning. Thank you. Next slide. I think I'm almost done. So in terms of the cleaning frequency, cleaning frequency, this is part of the SOP. This is just to give you some guidance around the frequency of cleaning for the different areas in the hospital setting. Patient bathroom and toilets should be, so most of these areas should be cleaned at least twice a day. So twice daily, except for the outside areas where it's a much more cleaner area and has low volume of inpatients. Thank you. Next slide. I think I hand over to Sarema. I just wanted to share with you this very simple dilution. This is the formula for diluting your sodium hypochlorite or your bleach. And so I had to get this information for some patients that were at home because they had the Genola bleach, but they didn't know how to dilute it. So if you look at your bottle of Genola in your house, if you have Genola, there's different trade names, and they may have different dilutions, but the bottle that says Genola, it contains, so when you look at it, it contains 4.5% sodium hypochlorite. And if you use the formula of dividing 4.5 divided by the 0.5% that 0.1% that you want, minus 1, it comes to 44 parts. So my advice to them is that you will use 1 cup of water to 44, 1 cup of bleach to 44 cups of water. So that's a simple dilution for household context of COVID-19 that we can all share with our, if you're giving advice. And I'm not sure whether this is part of the household guidance for COVID-19 that we have shared on the Ministry of Health Facebook page, but this is very important information to share to our patients who are at home. Thank you. I will hand over to Sarema now. Thanks, Sarema. Over to you.
Thank you, Margaret, for that presentation. Excuse me. I believe even if we don't go through the checklist and the audit tool, the presentation itself is self-explanatory, and it will definitely guide us on how we need to ensure that we're cleaning our areas properly, regardless whether it's in the homes or even in quarantine or isolation facilities. I think we've got some people talking. Can we have their mics muted? I had asked Liz if she could share the SOP for us, because I cannot share anything from my end. Liz, if that's possible.
No problem.
Thanks.
Yes, certainly. Dr. Pate, do you have, if I stop sharing, are you ready to bring up?
Yeah, I have the audit tool here.
Thank you.
Thanks.
I'll stop sharing.
Can everyone see that?
Yes.
Yeah.
Thank you.
Okay, so that's the audit tool. Sarema, you can go ahead and explain it and I'll scroll down.
It's right at the bottom. Yeah.
Is it that one?
Keep going.
I think I've gone past it. Oh, this one. Sarema?
Yeah. Sister Sarema, if you could unmute yourself, please.
Okay, sorry, somebody had muted me.
Yeah, I'm sorry. I did that. Apologies. I muted everyone. Sorry.
That's fine. Yeah, if we can move to Annex C, that would be much appreciated on the checklist. And as I was saying, no, we've gone back to the front, to the beginning. So as I was saying, now we have a checklist. The checklist is actually the steps that will guide the cleaners or whoever is there that's going to be responsible to clean, the steps that needs to be adhered to, from the gathering of the cleaning supplies, the equipments, right to the termination procedures or the doffing of the PPE. Okay? So as I've said before, and I'll say it again, let's not use the cleaning checklist as a tick in the box. And when I say that, I know that, you know, we've experienced this. The checklist is there, okay, tick, 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 yes, we have this, but then we do not really ensure that whatever items needs to be available for cleaning is there, or for disinfection, okay? Or even for PPEs. So I hope that the cleaning checklist will be a guide for everyone who's responsible in cleaning to ensure that things are done right according to what the SOP has stated. And in Annex D, it's talking about the audit tool. If we can move up to Annex D, Dr. Pate. So Annex D is the audit tool that can be used by our infection prevention control officers or our IPC link nurses, or even the supervisors, the team leaders, whoever is leading the team, whether it's in the isolation ward, in the quarantine facility, or even in the offices, okay? Because this cleaning and disinfection applies everywhere in all settings. So the audit tool is used as, not as a guide, but is used to gauge whether we are adhering to the cleaning and disinfection guidelines or SOP or not. And ideally for any IPC audits that's being done, and that includes the cleaning and disinfection, if we score 80% above, you know, that's showing us that we have strengths, even though there are weaknesses that we can improve in. Unfortunately, I can't control the screen from my end, so we can go to Annex D, where we're talking about the disinfection. Thank you. Right, okay. So that's the front page of the audit tool. And as I've said before, it can be used by the IPC link nurses or the IPCOs or the team leader or whoever is familiar with the audit tool. Okay. So the audit tool is a guide, and all the spaces needs to be filled. Okay, so if we go to the second page, page 13, it's telling us on how we will calculate the results of the audit tool. So it's the total number of yeses in all the criteria that we go through or that we audit, okay, divide by the total number of both answers, yes and no's, and we multiply that by 100, we should be able to get our compliance rate on our cleaning and disinfection. And as I've said before, having a compliance rate of 80% and above is a good picture that's telling us that we're adhering to the SOPs, that we're doing things in the right way. Okay. However, there are certain areas that we need to strengthen, and those are the areas where the auditor or whoever is auditing the cleaning procedures puts a 0 on the no column. Okay, so it talks about the entrances, the cleaning staffs or the staffs who will be responsible in cleaning. It even talks about the use of alcohol-based hand rubs, the appropriate alcohol content, and it even talks about your hand hygiene techniques. So you will notice that hand hygiene technique is compulsory in all areas. When you're doffing your PPE, when you're looking after or when you're caring for your patients, care of the deceased, and even here in cleaning and disinfection. So I know you will have a copy of the SOP with you. Please take the time to go through the audit tool, because when you're familiar with the audit tool, the audit tool is not actually, the content of the audit tool is not taken from somewhere else. It's taken from the SOP. So if you're familiar with what the audit tool is looking for, okay, or is wanting to ensure that it's adhered to, then you will know that you're actually following what the guideline or what the SOP has been stating or has been advising us to do. So I hope that from the IPC cell this evening. We hope that you will use this tool to audit your cleaning processes and your disinfection in whatever settings you are in, and also be familiar with the SOP that Margaret has shared. And please do not forget to use the checklist as well. Okay. Thank you, Patya and Liz. Over to you.
Thank you, Sister Margaret and Sister Sarima, for a very comprehensive presentation this evening, well thought through and covered all elements of the SOP, introducing the audit tool as well. Thank you once again. As with all our webinar sessions, we're inviting questions. You can either put your hand up or put your question in the chat section, which our presenters will also be able to see.
Hi, Liz. Sorry, while we're waiting for our participants for their questions, just another reminder, you know, when we talk about the audit tools, when we're doing audits, it's always good to do a baseline audit on your facilities if that's not being done, and you can use the audit tool on your cleaning and disinfection. And then you look at the gaps that needs to be strengthened or the weaknesses, and you put a plan on how you're going to implement those recommendations for improving or strengthening your cleaning and disinfection processes. And it's always good to do, you know, this is part of monitoring and evaluation process activity. And it's always good to revisit those weakness areas, whether they've become strengths, probably in 4 weeks' time or in 8 weeks' time. But ideally, in terms of cleaning and disinfection, it should be within 4 to 8 weeks that needs to be revisited to ensure that the weaknesses have now become strengths. Thank you, Liz.
Thank you very much. I could see Mr. Ibrahim has his hand up. Please unmute yourself. Thank you.
Thank you very much for allowing me to ask my question. Thank you, team, for a wonderful presentation. I have 2 things to say. So I am Dr. Abdul. I look after infection control practices at the CMET facilities here in Suva. One of the things that we have been noticing is that there are triple cleanings going on. So meaning that some people will clean once, wait a few hours, clean again, and then it happens again. As far as I am aware, and WHO recommendations that once is enough, maybe Margaret can probably shed more light on this. And the second point that I wanted to raise, okay, I'll just hold my question for the second point. I'll let Margaret say something here.
Probably Margaret is...
Sarima, would you,
Yeah.
would you like to answer that
Okay.
question, Sarima? I'm happy to support you. Yeah.
Thank you, Dr. Abdul, for raising that. We probably had missed it out in this presentation. You know, in the first SOP, it was written on triple cleaning. However, we had actually advised everyone that triple cleaning is not necessary. And a one cleaning process by using the two-way process that Margaret has talked about today, cleaning with the neutral detergent and then disinfection once is ideal. So I'm happy you brought that up, Dr. Abdul, and we'll ensure that this triple cleaning process, if it's happening in other facilities, we should stop doing triple cleaning.
Thank you very much. My next comment is regarding misters, machines that are used to mist equipment and surfaces with obviously sodium hypochlorite. It is important to note that, well, these have come into fashion, and donor agencies have been giving this out like Smarties. But the issue is that if you are using misters, obviously your eyes needs to be protected, which Margaret had mentioned, but also wiping needs to happen. So you need to wipe down things. It is not necessarily that you are going to mist something and then leave it there. Things need to be wiped down. So I think that clarification is also needed, and it's needed to be accepted by all. Yes, foggers and misters. Thank you.
Thank you, Dr. Abdul. We have a question in the chat here, and I can see also there's another hand up, which we'll come to.
Yeah,
so this question,
Liz, I'll just respond to Dr. Abdul first. Yeah, Dr. Abdul, you have actually answered. You have highlighted a problem, and you have also addressed it by sharing that information. So it's very, very important to note that cleaning precedes disinfection. So if you do not clean a surface, then the chemical that you're using will be ineffective. So it will not be effective. And as I had alluded to earlier, cleaning actually decreases the viral load on the environmental surface. And without that environment being cleaned first with detergent and water, the disinfectant process will not take place. So misting and fogging does not work. You see them spraying outside on the roadside and all that. So the dirt on the roadside itself inactivates the chemical disinfection. So regardless of what you do, you have to do the cleaning first before you do anything else. Thank you. I just wanted to reiterate that and stress that information. Thank you.
thank you. We have a question in the chat. It's regarding the disinfection of vehicles when transferring cases. The current practice is the use of spray bottles and allowing to dry. Bleach solution 1 is to 9. So what are your thoughts on that? Do we have any comments? Thank you.
Sarima, do you want to answer, or would you like me to answer?
You go ahead, Margaret. Thanks. I'll support
Yeah.
from response.
Yeah. So regardless of regardless of the surface that you're trying to disinfect, you must clean the surface first. And vehicles will have dirt on it. So if it's not cleaned with the detergent and water, and if you're just spraying it, it's not going to be effective. So regardless of the surface you're trying to disinfect, it needs to be cleaned first. I think that the message is the same. Thank you. And in regards to the strength, in regards to the concentration, as I had alluded to, the concentration is between 0.1 to 0.5%. So you can use, whatever strength you want to use within that frame, within that concentration. Thank you. Did you want to add, Sarima?
No, I totally support. I was just going to add on the concentration of the solution. However, I think from the observations that we're seeing right now on our cleaning and disinfection, we anticipate that there's going to be a change on our practice. And I know that Dr. Abdul had alluded that earlier, and that's what we're seeing, that there's no cleaning at all with neutral detergent, regardless where and when, but it's only the disinfection, the use of the sodium hypochlorite or the Milton solution. And there's mist, and even there's no wipes. So I hope that we will be able to relook at our cleaning practices and improve.
I think,
Sarima, you're on mute.
I think somebody has been muting me. Yeah,
It
thanks.
wasn't me.
Well, sorry, colleagues. Yeah, no, I was just, I wanted to add in on the bleach solution, but that's being explained by Margaret. However, I would like to stress again, because we've observed the current practices that's happening in the facilities, in the health centers. There's no cleaning, the use of water neutral detergent, but it's directly the use of Milton or sodium hypochlorite. So we hope after this enlightenment on this SOP, we should be able to review our cleaning processes and strengthen it as the SOP states. Thank you.
thank you.
There is another question. Sorry, go ahead,
No
please.
problem.
I was going to respond to the question.
Thank you. Please go ahead.
Yeah, there's a question in regards to environmental swabbing of surfaces for COVID-19. I think surfaces recommended for healthcare facilities that have just handled COVID-19 positive cases and need to reopen. And I think you may be referring to a health center that had a COVID-19 patient. I'm not so sure, but in this context, if you are following the schedule for cleaning and disinfection as per the SOP, there is really no need to do swabbing. So swabbing is not necessary, but what you should be doing more, what you should really stress on is the cleaning and disinfection of all the surfaces that you think that the patient may have come across. But otherwise, doing environmental swabbing takes up a lot of time, and also in this case, it may be difficult to get the specimen on a swab of the surface. Hopefully, I answered that question. So it's important that your cleaning is done, at least twice a day.
Thank you. We have a hand up from Lysana. Please go ahead.
Thank you very much for the presentation. I'm just concerned about in an operating theater setting, after cleaning, how long will we keep the room closed before using it, especially for our COVID theaters?
So in operating theater, you're talking now. I mean, it's a different context from the isolation centers. So, in the operating room, you would have had some. There may have been some exposures to aerosol generating procedures. So in this situation, it would be best to await around 3 hours, because number one, according to the research, aerosols can stay up in the air for up to 3 hours. So, the cleaning and disinfection, ideally, don't rush to do that. Do it, wait for a while before you do cleaning and disinfection in this context. And if you are sure that there were no aerosol generating procedures being performed, then you can clean and disinfect as we have highlighted or have presented, and it can be used immediately after that.
Yeah, I support Margaret's response to that. We're both on the same line. Thanks.
Thank you. So I know we've reached, we're close or at the end of the webinar this evening. I'd just like to invite the presenters if they have any closing comments. Sister Margaret, Sister Sarima, before we wrap up.
Probably I'll start first. I see there's another question here, again, on PPEs. So, you know, if we've already talked about PPEs, the SOP on PPE rationale. So please use that to guide you, especially on the cleaners, on what they need to wear, the appropriate PPEs they need to wear when they're cleaning. And whatever SOPs that we've been discussing or that we've been sharing, okay, it's always good that we adhere to this, and the contents are not actually taken out from thin air or from somewhere, but these are contents that's referenced to WHO, to CDC, to the IPC guidelines in UK, Australia, and other countries that have assisted the team or the task force in IMT and in the Ministry of Health, including the facility, to develop these SOPs. And it's been a pleasure sharing our knowledge on these SOPs and ensuring that we're all together on the same page. And we hope that whatever SOPs that we've been sharing with the other facilitators will help us to adhere to safe practices. It's not only for the patients that we're looking after, but also for us as frontlines. Thank you, Liz.
Thank you so much, Sister Sarima. Sister Margaret, do you have anything, any final comments?
No, just to thank everyone for their participation in attending this this session. You know, so it's an important session, especially in the context of COVID-19, because we are aware of fomite transmission, the potential for fomite transmission. Please support, if you know, support the cleaners. They're very important. Ensure that they are provided the necessary training that they need to have to clean correctly. And you know, feel free to reach out if you need any support. Vinaka.
Thank you so much. On behalf, I'm sure I speak on behalf of all participants this evening. Thank you for your, to both presenters for your time in preparing such a well thought out presentation. Thank you again. Thank you to all the participants. And again, I just want to remind you that the SOP and the audit tool are on the Ministry of Health website for your reference. And tomorrow evening, we'll be running there will be another webinar on the topic of vaccines that's being run by Dr. Rachel and her colleagues at WHO. And yeah, that's all for this evening. Thank you and have a great evening.